Hello, today we're continuing our look into the elements of a daily supplement to really invigorate your health, Lonicera longevity, and why you're probably still not getting enough vitamin D in your life. I'm Andrea Marsh, a shiatsu and Chinese medicine practitioner in the UK, and I help people alleviate their midlife health symptoms naturally. I know the power of supplements with health issues, and I became an advocate of Modexus when I noticed major changes in my energy levels when I took Lonicera longevity. I'm pleased to speak again today with the founder of the Modexus range, Dr. Charles Rouse. Dr. Rouse is a registered pharmacist, pharmacologist, and a doctor of natural medicine. As the head of the Modexus Product Research Council, he formulates the natural products for our health and longevity. Good morning again, Dr. Rouse.
Hey, Andrea, good morning. Good morning from Georgia. Evening, afternoon to you, but it's a big old world out there.
We're international. So you chose to put a good dose of vitamin D into Lonicera longevity, higher than the recommended daily allowance, which people still adhere to. I don't know about you, but I seem to be continually explaining to people that we don't get enough vitamin D, even if it's sunny. So today is all about your take on vitamin D, why we're not getting enough of it, and why you chose to put it in Lonicera longevity.
Hey, let's do it together. Andrea, you were right. Vitamin D is on most bottles labeled 400 units of vitamin D. The RDA, that's the recommended daily allowance, that was established decades ago, and it is far out of date. The RDA for vitamin D is grossly inadequate. I'm talking about a huge and growing amount of research has now shown that vitamin D deficiency in over 50% of every adult on planet Earth. And the numbers go as high as 80% in infants. And because of the too low, deficient levels of vitamin D, we're seeing the development of massive amounts of degenerative diseases. In fact, Dr. Charlie, a research scientist, I surmise that vitamin D deficiency is the most common medical problem or condition in the world, and taking higher doses is as simple as swallowing a good nutrition like Modexus has with the Lonicera longevity, because when you look on the label, 2,500 units versus 400 units otherwise. And you know what? It is definitely the most cost-effective strategy for improving your health. Just raising your vitamin D levels to therapeutic dosing can reduce the degenerative problems that the body is going to experience when you're low on vitamin D. The low vitamin D people, they have twice the rate of death. There's a known fact that when Corona came along and everybody was measuring who lives, who didn't live, well, the ones who died were D deficient. And you know, that goes to debilitating problems. The cancer research is looking at higher therapeutic dosing of D because of the influence it has. Cardiologists that deal with the heart, cardiovascular strength, arterial stiffness, diabetes, asthma, autoimmune, bone weakness like osteopenia, osteoporosis, high blood pressure, chronic fatigue, allergies, psoriasis, eczema, recurrent colds and flu, and yes, the mean old corona that's surfacing again. All of that is dependent on vitamin D. So, you know, with it being grossly inadequate, where are we heading? And the truth is that prevention could be as simple as a daily dose. And you know, me personally, research scientist, I don't just talk about it, I take it every day. I am a huge proponent. You're not going to be toxic with higher doses. It's not going to create any drug-drug interaction. But the truth is that vitamin D research is showing that if you want to prevent the heart diseases and the strokes, then it's going to require an adequate daily dose of vitamin D. The optimum and the safest dose is 35 units for every 1 pound of body weight. 35 units for every 1 pound. So, Andrea, if somebody weighed 200 pounds, I would multiply 35 times 200, and that person's daily minimum dose would be 7,000 units a day. See how grossly inadequate most people are? And when you look at the risk factors, when you look at the fact that most people get insufficient exposure to sunlight, which is a natural way to get D3, senior citizens, the older we are, the less likely our body is to have vitamin D. And the truth is that the darker the skin, especially in blacks, the darker the skin, their body takes a lot more sunlight than it needs just to get a little bit of D3. And the truth is that blood pressure and diabetes has always been a very devastating thing in dark-skinned people because they are D deficient. Breastfeeding mothers are always in greater need. And people that are overweight and moving toward obesity, they're going to have a much greater need for the vitamin D levels. So the recommended daily allowance is grossly inadequate, and it's going to take at least 2,500, maybe 5,000 units per day to even correct a deficiency. And as a scientist, I'm asking the physicians that are listening to this broadcast, don't be ignorant about vitamin D toxicity. The truth is that cholecalciferol, the natural vitamin D that's being used in supplemental products, is exceedingly safe, but very, very necessary. Does that sort of hammer in on what you were thinking about, Andrea?
Oh my gosh, that and more so. I mean, I've thought of about 20 questions to ask you just listening to that. I mean, I know I read about a Spanish hospital testing patients with COVID, and they reduced intake to ITU by 95% when they upped to very high doses of vitamin D. So I think I just learned so much from you there, because we just always get a vitamin D rickets, but that's so out of date. I mean, you've just gone into arterial stiffness, so that's female heart health for the menopause. I mean, you've listed so many things. I mean, and it's pivotal, obviously, on bone formation, brain formation. So I'm thinking dementias as well.
You're right. Just before breakfast this morning, Dr. Charlie took 5,000 milligrams of vitamin C, and I've already had 5,000 units of vitamin D because, hey, I'm in my 70s, and this whole world ain't getting any healthier. We better look after ourselves.
I know. And actually, coming back to, well, we're allegedly in the British summertime, but people say, oh, I've stopped taking my vitamin D, it's summer. But what people don't realize is the moment you put on sunscreen, you're cancelling out creating any vitamin D. So it's imperative to be taking relatively high doses from what you're saying all year round. I must admit, I'm a bit less in the summer and a bit more in the winter, but from what you're saying, it should be the same amount every day of the year.
All right. Hey, we really appreciate you, Andrea, for what you do for women's health, and may you keep up the good work.
Wow, I must admit, I think that's opened my eye to vitamin D a lot more than even I thought. So thank you very much for that, Dr. Rouse. And if you'd like to know about vitamin D being part of Lonicera longevity, then you look for Modexus on the website, or sorry, on the web. And if you'd like to know more about helping you through your menopause naturally, for the ongoing, health afterwards, then I'm Andrea from Cotswold Menopause.